Today we are back at the Roche office in Grenza. As our guest today we have Heiko. He is health economist and works at market access here at Roche. Thank you, Heiko, for being here and for taking some questions.
Thank you for the invitation.
From the market access perspective, how do you see the current developments in Germany about digital health?
Well, these are exciting times for working in that space of digital healthcare in Germany these times. And because, of course, over the last year, this new Digital Care Act has been implemented. And now we will see the first applications to get officially prescribed by a doctor or by other healthcare professional and then reimbursed by the statutory health insurance. And this is something completely new, really. And I think it's also unique, maybe in the world, but it's also unprecedented how this process has been implemented. For instance, the Federal Ministry of Health has been, come up with a proposal, and this has been discussed also with startup companies from the digital healthcare industry, but also with patients, with physicians and payers, and all of them have worked together to get this new legislation implemented into practice. And this is really new, and I think a very good process and a very good example how necessary changes in the healthcare field can be done very fast and also very wisely. So this was new, and this is really great. I think many people have waited for such a new framework, for such a new opportunity to get healthcare applications into the market. And this is not only good for the startup companies, this is also good for the patients who want to use them, and also for the doctors who can now prescribe them. And I think the doctors also want to have an idea, so which apps are really good, which apps lead to a good outcome, and they want to trust an app. And because there are so many apps available, they now get a better direction and guidance on which apps they can prescribe and use together with their patients.
Do you have any advice that you can give to startups when they think about how to set the price for their digital health products?
Oh, when it comes to setting the price, I think everybody will see and we will learn a lot about how price setting does work in the digital healthcare space. I think it will be a little bit different from other spaces, like for drugs or for medical aids. But I think what it's important to mention is that beforehand or up till now, there was always, or the only opportunity to get a regular reimbursement was if a digital application leads to a cost saving in the end, and then statutory health insurances were allowed to reimburse such an application. Now we have this completely new chapter for services, and pricing will shift from a cost-driven approach to a value-based approach, pricing approach. And this value needs to be demonstrated by positive effects on care, so that could be a medical benefit for the patient or a patient-relevant improvement in the delivery of care, in the processes and so on. And I think this value of an app will also be reflected in the price, and there is a fair mechanism of price finding between the manufacturer and the head association of the statutory health insurances, and they will negotiate fair prices. I'm pretty sure about that.
You just mentioned that there are some differences between pharmaceuticals and digital health solutions. Can you maybe explain one of the biggest differences that you see in all this market access process in Germany?
Well, one big difference is that these digital healthcare applications are new. So so many people or many stakeholders in the system are not used to judge a healthcare application as they would judge a drug or a medical device or other medical aid. And the recognition of the value of a digital healthcare app has to evolve, I would say. And I think this fast-track process will help for that, because it also requires studies and evidence where the companies or the apps need to demonstrate a positive effect on care. And this positive effects will also translate into a value which will be recognized by the price as well. But I think another difference is also that drugs are usually compared against other drugs, and here we are more open for a individual perspective on the app and how it is being integrated into the care process. And we need more integration in the healthcare system, and it's not just prescribing or downloading the app, using it, and then nothing happens. So it's really about making use of it.
Thank you, Heiko, for all these great insights from a market access perspective.
Thank you.
Hi, I'm Robert. I'm one of the co-founders of Roche, and if you want to know how to get into the German healthcare system, get to patients, get to physicians, get your product into this market, I'm the person to talk to. I'm very happy to meet you. I'm very happy to support you. Come see us.